Hey, it's your boy, your man-child, Logan, here with a much overdue update regarding my trip to Stanford Clinic to see Jayakar Nayak for empty nose syndrome. And the results are not that great. I wish I had better news for both my sake and yours, the whole ENS community. However, it was, I had some temporary benefit. I'll start by saying that before I go into any further details about what the process is like, in case you are interested in doing it yourself. I got Prolarin injections into my turbinates. It was kind of painful. I had the ENS 6, the snot test, snot 22. It stuck cotton in my nose. I definitely have ENS according to them, and that test, I felt better with the cotton in my nose, as Dr. Nayak said I hate my nose. And overall, it was a very professional experience. Dr. Jayakar Nayak is a very thorough, knowledgeable, compassionate doctor. So even though there might be some naysayers that say he's only interested in money, I found him to be quite personable and genuinely interested in the topic itself, having an academic interest. I arrived, and the first I had the snot 22 and the cotton test on the first day, and then we went over my history, my surgeries, and how long I've been having symptoms, and it was very routine. And his assistant was there. I can't remember that guy's name. I wasn't sure if he was an actual MD yet, or if he was a physician's assistant. He said his wife had turbinectomy, and that she was fine. That doesn't make me feel any better, so I don't know why he told me that. Aside from maybe having some interest in why there's this discrepancy. Why do some people get ENS and why do some people not? Perhaps it's due to the technique used and, susceptibility of nerve tissue. All tissue has nerves in it. The nerves in the nose. Similar to how some people get cancer despite barely smoking or drinking, and some people don't despite smoking and drinking, having that predisposition. So I got that done, and he said, yeah, I'll call you in a day or two, and you'll come back, and then we'll do the injections of Prolarin. And these are supposed to last about 3 months, and that's pretty much what they did. But the process of doing that was painful, because I guess I apparently do have some nose tissue or nerve tissue in there, and it hurt, because it hurt, and then I was sneezing, even though they did some lidocaine injections. And it could be, there was a different, the little bit of turbinate tissue that I had was still, had nerve endings that were viable. And even though I have maybe 15% on my left side and 5% on my right. Immediately after, I did feel more fullness, more resistance in my nose, breathing wise, and for the few days after, there wasn't really any swelling. I did notice that there was a little bit more moisture in my nose. So in that regard, I did feel a little bit better. And in terms of the airway, I didn't feel better, partly because I think that, which is what the computational fluid dynamics, airflow studies are trying to figure out, is the air has to hit a certain, has to hit your turbinates a certain way, so your brain is getting the message that you're getting airflow, and in the right amount of airflow. Immediately, I will say this, immediately after the procedure, because I had some questions for Dr. Nayak, and he wasn't able to answer them the first time, he sat down with me and was late to some event he had to go to for an hour, and which I really respected. And so I told him all what I knew. I asked all my questions. What was interesting is that we disagreed about whether it's about nerve endings or versus airflow. He thinks that it's more of an airflow issue, and that Dr. Hauser thought it was more of a nerve issue, and that he came more along to Dr. Nayak's viewpoint. In the coming months, or the following months, of course, it wore off, but I had a probably solid 2 months where, at least moisture-wise, my nose felt a little bit better. But was it enough for me to want to go back and get the cartilage implants? I would say not at this time, especially since it's not going to be, it's probably not going to be, covered by as much living, humidifying tissue. He did say, hey, come back and get the cartilage implants, because he definitely thought I was a candidate. But after careful consideration, I decided that I wasn't going to do that at this time, because I have other health problems. Unfortunately, I got cubital tunnel syndrome, and I got hyperacusis. I might need to get surgery. Well, I definitely need it for my elbows, but maybe for my ears too. It was covered by insurance, so if you depending on your insurance, you might be able to get it covered. I wouldn't have been able to go had it not been covered by insurance. So it's you really have to weigh the pros and cons here, because if you're expecting to get some significant benefit, that a lot of people have had implants. They say it's marginally helpful. Is it worth it for them? I mean, people have unfortunately killed themselves over empty nose syndrome and the suffering that it causes, and the cartilage implants, or the alloderm, gave them just enough breathing room, no pun intended, actually yeah, pun intended, to want to keep on living, or to be able to bear it. I mean, desire doesn't necessarily factor into it. But I think one thing that we should that should factor into the desire to want to do is that there's more treatments potentially coming out for it. If you're looking at like cutting edge stuff, or risky stuff that you're willing to gamble on, the mesenchymal stem cell research is something you could look into. Although I don't think it's viable at this time. I think it's too big of a risk, especially since you're going to be paying out of pocket to fly to Ukraine. I think there's any in the U.S. right now. And these stem cells supposedly are going to be able to regenerate tissue. Nayak is working on, the turbinate tissue. He's working on getting a grant for it. I'm not sure if he acquired it. I just messaged him about it, and he got a grant for upper airway stem cells. I'm not sure if that is including the nose. So, yeah, that is a summation of my visit. I hope that answers all of the major questions you have. I'm sorry I don't have better results. I really wish I did. But I don't think that that proves Nayak is worthless in the ENS research community. I do think there are other physicians, that if they're only doing PRP injections or ACell, they're really not doing enough. They need to be doing research, because that's what we need. And especially considering a lot of us are out of jobs or unable to work, I think that finding a way to get it covered by insurance is paramount. So there you have it. And please subscribe to my channel, hit the like button. I know everybody says that, but it's really important to me in particular because I suffer with all these health problems, including and not limited to ENS, and it helps distract me and gives me something to look forward to. And I plan on putting out more content that's funny and that's entertaining, so that I can help distract you and help give you something to look forward to.